Moving on here at 8:38 in your Health Watch this morning, weight loss drug Ozempic and its popular counterparts have seen a number of copycats on the market. Just last month, the World Health Organization warned about fake batches of Ozempic that they were found in the U.S., UK, and Brazil. So joining us now to talk about the impact of fake Ozempic is medical weight loss doctor Sue Decotiis. Thanks so much for being with us, doctor.
Thank you for having me.
All right, so what do people need to keep in mind when we're talking about this massive weight loss drug, the shortage that's happening right now?
So the shortages have probably encouraged some of these companies that are not legitimate to make counterfeit Ozempic, which is semaglutide, counterfeit Mounjaro, which is Wegovy, which is Zepbound. And this is very scary because some of these counterfeit drugs actually make their way into legitimate commercial pharmacies. So that's what's really scary. And what can be in this counterfeit medication? There may be nothing in it, or there could be less than the drug that someone should take, or too much drug, or no drug at all. But what for me is really scary is they have found insulin in some of these injections, which is somebody can die from an overdose of insulin. So this is really scary. Luckily, it doesn't happen that often, though it has happened around the country. I mean, I see patients in my office and virtually from all over the country, and people have had friends and family that have been subject to this. I think the biggest risk, though, and this can be avoided, is for people that are buying these products online without a prescription. So that's a huge red flag. If you're able to find a website where you can buy Ozempic or Mounjaro or semaglutide or tirzepatide or Wegovy or Zepbound, there is a problem. Don't buy it. So this is very simple. Now, the pharmacies are on the lookout now. They know that they can only buy medication from licensed manufacturers who work with the major pharmaceutical companies like Lilly or Novo Nordisk. But if you get something that looks suspicious, like the label looks strange, or you can always check the serial number. If something looks odd that you've gotten from the commercial pharmacy, call them immediately and tell them this does not look right, but never buy anything online.
Now, you're talking about the dangers of online prescription, people going on. Unfortunately, price does play a major factor in people going online. But another important reminder for folks to keep in mind is just to go to see your doctor in person.
Yes. And in my practice, I do use a lot of compounded products, but I have researched the companies that I use, and they have scientists that run these companies that have actually invented some of these medications. So not all compounding pharmacies are bad. However, I get the drug directly from the compounder. They don't send to a patient without a prescription. Okay, so this is the big difference. And you can check, there is an American Board of Compounding Pharmacists. You can check to see if that pharmacy is legitimate. But again, if you're buying it yourself, not a good idea. Now, there are some online apps that you can get, which I don't recommend, because even though they're technically legit, you're not seeing a physician in person, you're not getting weighed. And in my practice in Connecticut and New York City, I use a body composition scale so that I can really figure out where someone's body fat and muscle mass and their body water is going. Without that, sometimes I think you're shooting in the dark. And that's how you adequately get people to lose weight.
And Dr. Decotiis, I have a quick question for you. I know you were saying not to do anything online, but what about telehealth? Because a lot of people have started to use telehealth and actually speak to their doctors, see their doctors in person via Zoom. So would you say that would be the exception?
That's fine. That's fine. If you know the physician and the physician knows you, that's what you're talking, that's fine. But if you're seeing someone anonymously, you're going online, you don't know this practitioner, maybe a PA, maybe a nurse, maybe even a physician, but they don't really know you that well. They're maybe doing one consult, and a lot of times they're taking your money up front, but they're not able to get the medication because there are such shortages, right? So that's the problem. So a lot of patients, before they've seen me, have gone to these online platforms and have gotten ripped off. They never got the medication. They got a prescription for a medication like metformin that they could have gotten 10 years ago. or some older iteration of Ozempic. So they were very disappointed. And it's always better if you can see the physician in person, especially
Absolutely.
if that physician has a body composition scale, which is so important.
Absolutely. All right, Dr. Decotiis, thanks so much for your help and your important information. A lot of stuff for people to keep in mind.